While sometimes feeling down is common, depression goes beyond brief periods of sadness. We now know that depression is more common than we thought, and that if the symptoms last for 2 weeks or more, it could be a sign of a serious mental illness. Depression is a significant illness that has an impact on a person's thoughts, feelings, and behavior. Anyone may develop depression at any age, and a variety of factors, including gender, might change the symptoms. There are several ways that men and women may experience depression differently. Women are almost twice as likely as men to experience significant depression, although this disparity may be due to social stigma towards men who admit to having depression, which may lead them to downplay or deny the problem. Many men are avoiding going to a doctor when they are depressed, which has resulted in a misunderstanding of depression among them. Men may experience depression differently from women, due in part to the expectations put on them by society. Young boys are frequently taught that they should be harsh, independent, and competitive, and that it is inappropriate for them to cry or display intense emotions since these traits are seen as feminine. Boys may learn to use guilt, anger, and other negative emotions as well as coping skills to deal with grief. The causes of depression. The feeling of depression may be brought on by chronic stress, inactivity, losing the person that we love, including through a divorce or a death, losing authority, physical power, sexual prowess, or financial status. Physical symptoms of depression. Men who are depressed could first experience physical symptoms, including pain, chest tightness, digestive issues such as gas, constipation, or diarrhea, headaches, heart palpitations, weight loss, low testosterone, impotence, and other sexual health issues. Mental symptoms of depression. Men who suffer from depression are more likely to experience mental symptoms such as difficulty focusing, memory issues, compulsive behaviors and thoughts, sleeping problems, and suicidal ideas. Behavioral symptoms of depression. Men's depression may have behavioral effects because some of them find it difficult to talk about their feelings. Other people often notice depression in men more via their behavioral symptoms. Inappropriately expressing anger, staying late at work, acting riskily, becoming addicted to drugs or alcohol, having difficulties managing work, family, and other obligations, social isolation, and suicide attempts. These are the most common behavioral symptoms of depression. Why men's depression is underdiagnosed. There are several reasons why depression in men is not properly diagnosed. If a man has physical symptoms of depression, he may not be aware of them. They usually downplay the symptoms or avoid discussing them. Even men who are doubtful they could have depression may reject or delay seeking medical help out of concern that the shame of a diagnosis would affect their jobs or personal relationships, and other reasons that are not well understood. Depression may lead to suicide. The numbers of people that attempt suicide are similar for each gender, but the overall suicide rate for men is 4 times higher than that of women. How to treat depression. The most common methods for treating depression are talk therapy, medication, or a combination of the two. A medical professional can help you come up with a treatment plan that is just right for you.